My name is Jim Anderst. I'm the Division Chief of Child Abuse and Neglect at Children's Mercy Hospital in Kansas City, Missouri. I evaluate children where there are allegations or concerns of child maltreatment, physical abuse, sexual abuse, neglect. I came into this field because I wanted to make sure that children and families who interact with the child protection system and the legal system essentially get a fair shake. The science in this field is rapidly growing and deepening, and it has to be appropriately applied to these cases so that children don't get sent back to abusive homes or removed and put into foster care or somebody goes to jail when it really was an accident. And so what I really aim to do is apply the science of pediatric forensics to children and families to improve their lives so that we as a society can handle our struggles and issues better. So about 1,500 to 1,600 children a year in the United States die from child abuse and neglect. To put that into perspective, less than 100 die from asthma every year. But most people are really familiar with asthma and all the things that it can do or cause. But child abuse and neglect causes much more death and harm to children in a short and long-term perspective. The biggest drivers of child maltreatment are parents who are ill-equipped to handle young children, parents who are in poverty and lack resources, societal and community resources, and parents who have really inappropriate expectations of what their children should be able to do. For instance, infants and young toddlers being able to do certain things quickly. People aren't ready to handle that in their lives. Technology has not historically been used very much in child maltreatment evaluations, both medically or through societal involvement. There's not a lot of funding in the field, and so there wasn't historically much money to pay for technological advances. Child Protector is really a leap forward. Using a smartphone app to evaluate potentially maltreated children is a big jump for the field, and really puts the necessary technology in the hands of the users, the frontline users, medical and investigative and child protection. My hope is that Child Protector can kind of blaze a path for people and show them how technology can help improve their work and really incentivize further funding for the field and further use of technology in the evaluation of possible child maltreatment. What keeps me up at night or worries me is that there are a lot of people out there, investigative folks, medical folks, who want to do the right things for kids but aren't supported appropriately or aren't trained appropriately, and might be trying their best but aren't able to serve children and families the way that children and families in our society needs to be served. It troubles me that these folks want to do the right thing, but they don't have the resources around them to actually do the right thing. So Child Protector was developed to help first responders, medical professionals, children's protective service workers make good decisions with respect to forensic evaluations of possible child maltreatment. What folks can do is tell others about the app, explore it, use it, get to know it, and advance the use of technology in the evaluation of possible child abuse. I really think the biggest change in child maltreatment evaluations is going to be technology. I think the use of something like a smartphone app is a first step. I think people are going to be using electronic medical records to appropriately identify children and make sure that evaluations are done in a quality manner. I think investigative services are going to be using technology and interacting with medical professionals using technology, and it's going to change the way this is done. Right now we're in a paper and press mode, and it's going to jump forward rapidly.